What to expect when monitoring hydroxyurea for sickle cell. Starting hydroxyurea for sickle cell disease is a big step, and monitoring is key to making sure it works well and stays safe. When you begin treatment, your healthcare team will schedule regular blood tests to keep an eye on your blood counts and how your body responds. These tests are usually done every 4 weeks, especially when your dose is being adjusted. They check your complete blood count, which includes your red blood cells, white blood cells, and platelets. The goal is to keep your white blood cell count, especially the neutrophils, at or above 2,000 per microliter, though some children might tolerate lower levels safely. Platelets should stay above 80,000 per microliter. If your blood counts drop too low, your doctor might pause hydroxyurea temporarily and check your blood weekly until your counts recover. Once they do, the medication can be restarted at a lower dose, usually about 5 milligrams per kilogram per day less than before, and carefully increased again. Dose adjustment is a gradual process. Your doctor will slowly increase the dose by about 5 milligrams per kilogram per day every 8 weeks until reaching the maximum tolerated dose. This is the dose that causes mild bone marrow suppression without leading to dangerous blood cell reductions. Typically, the maximum dose does not go beyond 35 milligrams per kilogram per day. The aim is to achieve a mild suppression of the bone marrow, which indicates the medication is working without causing harm. Monitoring how well hydroxyurea is working involves checking certain lab markers. Your doctor will look at your mean corpuscular volume, which tends to increase with hydroxyurea use, and your fetal hemoglobin levels, which should rise as the medication stimulates your body to produce more fetal hemoglobin. Higher fetal hemoglobin levels help prevent sickling of red blood cells. Sometimes, your doctor might analyze the percentage of red blood cells containing fetal hemoglobin, called F cells, once a year to see how many cells are protected. Improvements in your health, like fewer pain crises, less frequent episodes of acute chest syndrome, and a reduced need for transfusions, are also signs that the treatment is helping. Adherence to your medication schedule is very important. Your healthcare team may assess how well you are sticking to your hydroxyurea routine through conversations, lab results like mean corpuscular volume and fetal hemoglobin, and by observing your clinical progress. However, these methods are not perfect, and encouraging consistent use of the medication can sometimes be challenging. Safety is always a priority. Hydroxyurea is generally well tolerated, and serious side effects are rare. The most common issues are mild, reversible drops in blood counts, which are carefully monitored to prevent complications. Regular blood tests help your doctor balance the benefits of reducing sickling with the risks of low blood cell counts. Many patients see their health improve with fewer pain episodes and hospital visits, making the monitoring process worthwhile. Your healthcare provider will typically see you every month during the initial phase when your dose is being adjusted. Once your dose stabilizes and your blood counts are steady, visits might be spaced out depending on your individual situation. Always follow your provider's advice, report any new symptoms or side effects promptly, and keep up with scheduled tests. Monitoring hydroxyurea closely helps ensure it remains a safe and effective part of your sickle cell disease management, reducing complications and improving your quality of life. Remember, every person responds differently, so personalized medical guidance is essential for the best outcomes.